So I'll quickly skate over everything that you can possibly get in the way of information from the NJR. This is my conflict statement. First of all, the annual report. This is a huge resource, huge literally. Last year it was 365 years. We won't be printing it again, but actually we've split it into sections to be more manageable. This year it's got shoulder, elbow and ankle sections that are already published online, and the hip and knee sections have been delayed, and Mike will go over in detail later the reasons for that and what we can expect in the near future. But the website itself provides a wealth of other information, background, other reports, statistics online, and many useful documents for those who want to see them. And you can see all sorts of things. You can see how we work. You can see the basis of our transparency and accountability model, which I think is of relevance to a lot of you. And all sorts of statistics, such as the joint activity. And this, for example, is the last 6 years of data about how many joint replacements have been done. It's updated every week, so you can see whether we're doing better or worse than last year, better or worse than during COVID, and better or worse than before COVID. I think this is probably something which should be used more often and by more of us. As a victim of arthritis, I've just put myself through this tool and found it really quite useful. It gives you quite a good idea of what might be expected from your operation, and I think that we should be encouraging all of our patients to use it. There are huge numbers of publications now come out of the registry, and sometimes it's difficult to find them. We've tried to make it easy. The recent publications have a link from the website, and the older publications are included in this list of papers, which is downloadable and available as an appendix to the annual report. If you want to find out what your surgeons like, what they can do, what they have done, then that data is available both by surgeon and by hospital. It's not exactly the same data. The hospital data shows the revision rates. The consultant data doesn't show the revision rates in this because it's available to the public. But it shows for the hospitals which surgeons work there, for the surgeons which hospitals they work in. It gives you an outline of their practice over the last year and 36 months as pie charts, as individual numbers, and compared with the average numbers for either a hospital or a surgeon in the country. And it tells you the outcomes in terms of revision rates, outcomes in terms of mortality, and the patient data. And it's important that those patient demographics are used for the adjustment of the data. And a lot of people don't realise that. They say, well, I've operated on all of the most difficult patients. That may be true, but it is already adjusted for many parameters. This is where you'll find most of the things of interest to you personally as surgeons, or as management, or as suppliers and manufacturers. The data services website, and you have access to one of those, all of you clinicians. Management have access to management feedback. Some people in the NJR, but not very many, have access to the outlier management, and manufacturers have access to supplier feedback. So clinician feedback offers you these various options. So if we go into My Data, you can see that you can filter by all sorts of different things. You can look at the hit data, and you can use these filters to look at the 1 year, 1, 3, 5, 10-year data about your practice. You can select the independent sector or the NHS sector, consulting and charge data, or the lead surgeon data. And you can select it down pretty much as you would wish. You can also get a complete list of all of the patients who've been entered under your name, whether they're alive, whether they've been revised or not, whether they've died, if so, how long before that endpoint was reached since the operation. And you can download those so that you can check them all against your hospital data. You can look at your whole practice over the years, somewhat depressing for some of us who've been in decline for some years. But nevertheless, you can see that. You can then click on an individual bar and see how many knees, how many hips, shoulders, or whatever you did that year. And then you can drill down with those filters on the individual year as well, if that's what you wish to do, with all of these various parameters. And there are reports. The reports section is unique to you, and it's your reports from either your individual practice or from your hospital practice. So the consultant level reports, which I think can be used for all sorts of things, but in particular for clinical decision making, for use in your appraisal, which I think a lot of people do, making implant choices, seeing what your practice is like in relation to the NICE guidance and other association guidance, and for some certain performance assessment. And likewise, the annual clinical reports for the trusts give you ammunition for CQC inspection, or make with them ammunition, of course. Clinical quality improvement programs. It may help you to identify where problems are before anybody has to come and look at your practice, and demonstrate improvements that when you've made those changes. And it gives you surgeon comparative and performance between and within units. And it can be used very much to try and improve morale when you are able to demonstrate benefit and improvements. Sadly, the problems reports that were regularly given every year have dried up. This is the last one I had in July 2021. I don't think that any of you have had one since. But the good news is we have been promised, only last week, by NHSE that they are now treating it as a priority to give us the PROMS data from the hip and knee national PROMS programme, and it is a key priority for them, which we will continue to press them about. There are implant reports called Embed, which will give you details about which implants you personally have used and how much you paid for them, or how much the hospital paid for them, if the hospital is putting all of the data in, which unfortunately is not always the case. This is a new one last year, the implant library, and this data has been available in the annual report, but many people don't wade through it. So now you can find out the answer to this question. If you're using the blue implant, it will be made available to you, that information. It won't be if only about 6 have been done in the country, which is not worth doing the analysis. But if there is a decent number done in the country, then we now give you the 1, 3, 5, 7, 10 year analysis with confidence intervals to see, so that you can see what the implant you're using does exactly. And we're going to highlight the 10-year data so that you can see how it does against the latest NICE guidance. So if we look at the management feedback, you get almost all the same data for the hospital, but the managers can access this. Well, an individual manager who's been nominated by the trust can. The same sort of filters are available for hips, you can see for knees. You should bear in mind, though, that these dates are all different. These analyses are performed at different times, and you won't get the latest survival analysis immediately. They're often a year or even a little bit longer delay, but the latest procedure data are updated almost live. And you can see there the similar knee data. So as far as supplier feedback finally is concerned, there are lots of reports which you don't have access to directly at the moment, although we're working on it. But the suppliers have access to their own devices, and it produces a report like this. You can see they get a huge amount of information about the patients that their devices were put into, whether they have particular ways of failing, whether they have particular ways in which they're better than other implants, and whether that applies to whether you resurface the patella or not, whether that applies to whether you're using a PS or a constrained or an unconstrained implant. So the resources available are really pretty enormous. I've only shown you a small sample. Really exploring the system with a few days to work on it is the only way of really finding out what's available. And if you do that and you find that there are things that are not there that you want to be there, then we'll look as well. And if we can't find them either, we'll consider giving them to you. Thanks very much. And now